Understanding ulcers, a comprehensive guide. What are ulcers? Ulcers are painful sores that form on the lining of the digestive tract. Depending on their location, they are categorized into gastric ulcers, stomach, duodenal ulcers, upper part of the small intestine, and esophageal ulcers, esophagus. These ulcers result from a disruption in the mucosal barrier, allowing digestive acids to damage the underlying tissue. If left untreated, ulcers can lead to complications such as bleeding, perforation, and severe infections. Types of ulcers. 1. Gastric ulcers develop in the lining of the stomach and are often associated with meals due to increased acid production. 2. Duodenal ulcers, found in the first part of the small intestine, duodenum. These are more common than gastric ulcers and often cause pain a few hours after eating. 3. Esophageal ulcers occur in the esophagus and are often related to chronic acid reflux, GERD, or ingestion of certain medications. Causes and risk factors. 1. Helicobacter pylori, H. pylori, infection, a spiral-shaped bacterium that damages the mucosal lining, making it susceptible to acid. H. pylori is a leading cause of both gastric and duodenal ulcers. 2. Nonsteroidal anti-inflammatory drugs, NSAIDs. Medications like aspirin, ibuprofen, and naproxen can weaken the stomach lining and inhibit protective prostaglandins. 3. Excess stomach acid production. Conditions like Zollinger-Ellison syndrome can cause excessive acid secretion leading to ulcers. 4. Stress and lifestyle factors. While stress doesn't directly cause ulcers, it can aggravate symptoms and delay healing. Smoking, alcohol, and irregular eating habits contribute to the risk. 5. Poor diet. Consumption of highly acidic, spicy, fatty, or processed foods may irritate the stomach lining, exacerbating ulcer symptoms. Symptoms of ulcers. Burning or gnawing pain in the abdomen, especially between meals or at night. Nausea or vomiting, sometimes with blood. Loss of appetite or feeling full quickly. Bloating and frequent burping. Unexplained weight loss. Black or tarry stools, a sign of internal bleeding. Fatigue, due to anemia from blood loss. Diagnosis of ulcers. 1. Endoscopy, EGD. A small camera is inserted through the mouth to inspect the esophagus, stomach, and duodenum for ulcers. Tissue samples, biopsies, may be taken to test for H. pylori. 2. Barium swallow, upper GI series. A series of X-rays taken after the patient drinks a barium solution, which coats the digestive tract and highlights abnormalities. 3. Blood, stool, and breath tests, used to detect H. pylori infection and assess the presence of anemia or hidden gastrointestinal bleeding. Treatment of ulcers. 1. Antibiotics, used to eradicate H. pylori infection, commonly a combination of clarithromycin, amoxicillin, and metronidazole. 2. Proton pump inhibitors, PPIs. Medications such as omeprazole and esomeprazole that block acid production and promote healing. 3. H2 receptor blockers, such as ranitidine or famotidine, which reduce the amount of acid the stomach produces. 4. Antacids and alginates provide rapid symptom relief by neutralizing existing stomach acid. 5. Protective medications, sucralfate or misoprostol may be used to coat the ulcer and protect it from acid. 6. Surgical intervention. In rare cases, surgery is needed to remove ulcers or repair perforations. Managing ulcers. Follow prescribed treatment, take medications exactly as directed and complete the full course of antibiotics. Regular follow-ups, monitor healing through repeat endoscopy if symptoms persist. Avoid triggering substances, stop using NSAIDs if possible, and avoid alcohol, tobacco, and spicy foods. Implement lifestyle changes, manage stress through therapy, meditation, deep breathing, or regular exercise. Dietary recommendations. Foods to eat. 1. Bland foods. Soft, low-acid foods such as boiled potatoes, oats, bananas, applesauce, and white rice are gentle on the stomach. 2. Fiber-rich foods, fruits, e.g., pears, apples, vegetables, e.g., carrots, broccoli, and whole grains support gut health and prevent constipation. 3. Probiotics, yogurt, kefir, and fermented vegetables help restore healthy gut bacteria and may reduce H. pylori infection. 4. Lean proteins, skinless poultry, tofu, and fish are easier to digest and support tissue repair. 5. Healthy fats, use small amounts of olive oil and avoid trans fats. Foods to avoid: 1. Spicy foods, chilies, pepper, and hot sauces can irritate ulcers. 2. Fatty and fried foods, these can slow digestion and increase acid reflux. 3. Acidic foods, citrus fruits, tomatoes, and vinegar-based foods can worsen symptoms. 4. Carbonated drinks, increase bloating and pressure on the stomach. Drinks. Drinks to include water, drink throughout the day to stay hydrated. Herbal teas. Chamomile, licorice root, and slippery elm may soothe the stomach. Aloe vera juice, in small amounts, it may help reduce inflammation. Drinks to avoid: caffeinated beverages, coffee, energy drinks, and certain teas stimulate acid production. Alcohol damages the stomach lining and interacts with medications. Sugary drinks cause bloating and can irritate the digestive tract. Home remedies. 1. Ginger, known for its anti-nausea and anti-inflammatory properties, can be consumed in tea or small raw portions. 2. Aloe vera juice may reduce irritation and inflammation of the stomach lining. Take in moderation. 3. Licorice root may promote mucus production, protecting the stomach lining. DGL, deglycyrrhizinated licorice, is a safer option. 4. Honey, especially raw honey, has antibacterial properties and may help soothe ulcer pain. Note: home remedies are supportive and should not replace medical treatment. Prevention of ulcers. Limit NSAID use. Use them only when necessary and under a doctor's guidance. Treat H. pylori early, get tested and treated if you suspect infection. Quit smoking, reduces acid production and improves healing. Eat regular meals, avoid skipping meals and eat smaller, more frequent portions. Manage stress, incorporate mindfulness, exercise, and proper sleep into your routine. Stay hydrated and maintain a balanced diet, protects your digestive health overall. With the right combination of medical treatment, lifestyle changes, and dietary adjustments, ulcers can be effectively managed and healed. If you suspect you have an ulcer or experience symptoms, consult a healthcare provider promptly for diagnosis and treatment.